Respironics is dedicated to providing devices and educational materials that will help make aerosol drug delivery effective and more acceptable for patients. Your doctor has prescribed taking respiratory medications with the compressor nebulizer system that allows the medicine to go directly to the lungs where it is most effective. This video will show you how to use the MicroElite compressor nebulizer system. The MicroElite compressor provides air pressure that works with the nebulizer to turn medication into a fine mist. The unit can be completely handheld by inserting the nebulizer with the gray connector into the side of the compressor, or it can be used with the tubing that comes with the nebulizer handset. To use the handheld method, simply insert the gray connector with the nebulizer attached into the air outlet on the side of the compressor. When using the MicroElite with tubing, place it on a hard, flat surface such as a table or counter. The tubing that comes with the nebulizer handset has a gray connector attached at one end. Place the nebulizer onto the gray connector. Attach the other end of the tubing into the air outlet on the side of the compressor. You should regularly check the air filter. Unscrew the filter holder from the compressor to replace it at least once a month or sooner if it becomes dirty. When powering the compressor from a wall outlet, insert the AC power adapter into the power receptacle on the back of the MicroElite compressor. Plug the AC power adapter into the wall outlet. When operating the compressor from a vehicle power source, insert the 12-volt DC power adapter into the power receptacle on the back of the MicroElite compressor. Plug the other end into an appropriate vehicle power source. When operating the compressor from the rechargeable battery, rotate the gray protective contact cover on the bottom of the MicroElite compressor by grasping the gray tab and pulling it in the direction of the arrow. Place the compressor on top of the battery, aligning the back side of the compressor and the rear of the battery. The front of the compressor will engage with a click. No matter which power source is used, the compressor is turned on and off using the power switch on the top of the compressor. If you need to stop the aerosol treatment at any time, turn the compressor off. The MicroPlus reusable nebulizer uses air from the MicroElite compressor to turn your medicine into a fine mist that you breathe. Use it regularly and replace it after 6 months of use. Remember to always wash your hands before you set up the compressor nebulizer system. The parts of this nebulizer include a mouthpiece, a top, a baffle, and the medicine cup. Adult and pediatric masks are available separately and can be attached to the nebulizer in place of the mouthpiece. An adult should supervise the setup and operation of this compressor nebulizer system when being used by a child. After connecting the plastic tubing to the compressor, lift the top from the medicine cup. Add the medicine prescribed by your healthcare provider to the medicine cup. Ask for assistance if you're not sure of the amount. Follow the instructions provided by your doctor or those instructions provided with your medication by the manufacturer. Replace the top back on the medicine cup. Attach the mouthpiece. Always keep the nebulizer upright to prevent the medicine from spilling out. When using a mask, remove the mouthpiece and simply attach the mask adapter to the nebulizer outlet. Begin the aerosol treatment by turning the compressor on. The nebulizer will create a fine mist. Place the mouthpiece in your mouth. Be sure you're in a relaxed, upright position. Remember to breathe through your mouth, not your nose. It's important to get the medicine into your lungs. Take 2 or 3 slow, deep breaths between normal breaths. If you need to stop before the treatment is complete, turn the compressor off. The average 3 milliliter treatment usually takes about 7 minutes. You'll hear a sputtering sound when it's time to stop, and the mist will stop coming out. You may need to tap on the side of the cup to be sure you get as much medication as possible. It's okay if there's a small amount of medicine still in the cup. Do not run the MicroElite compressor longer than 20 minutes. After 20 minutes of runtime, the compressor must remain off for 40 minutes before restarting. The MicroPlus reusable nebulizer must be cleaned between each treatment. Remove the nebulizer from the gray connector. Do not wash the tubing. Take the MicroPlus reusable nebulizer apart. Wash all its parts in warm soapy water. Rinse the parts in clean water, making sure all the soap is rinsed off. Let the parts air dry. You should disinfect the nebulizer parts at least once a week. However, do not disinfect the tubing or mask. Boil the parts in water for a maximum of 5 minutes. Rinse with clean water and allow to air dry. The rechargeable lithium polymer battery for the MicroElite compressor is designed for simple and easy use. When the battery needs to be charged, the indicator light will turn orange. When charging the battery, plug the AC power adapter into the rear power receptacle on the battery. Plug the other end of the AC power adapter into the wall outlet. The indicator light will turn orange to indicate that the battery is charging. Charge for at least 3.5 hours. The indicator light will turn green when the battery is fully charged. Unplug the AC power adapter from the battery receptacle. When operating the compressor from the rechargeable lithium polymer battery, rotate the gray protective contact cover on the bottom of the MicroElite compressor. Align the back side of the compressor into the rear or back of the battery. The front of the compressor will engage with a click. To remove the rechargeable lithium polymer battery, press and hold the release button on the battery. Separate the compressor from the battery. When it's nearing the end of its useful life and it's time to replace it, you'll notice that the time between charges will be shorter. Now that you've completed watching this instructional video, you should have a better understanding of how to use your compressor nebulizer system. Watch as often as needed to make sure you understand the use of the MicroElite.